Hello, Dr. Clearfield.
Hey there.
How are you?
I'm okay. Had to come home. The my internet is not working at the office today for some reason.
Okay.
So we have shadows trying to get get worked out. And that's not
Relying on internet.
that's any better. Unfortunately,
Yeah.
in my den, the sun shines right on my desk here at this time of day. So uh
Oh, yeah, you're 3 hours ahead of us. Us is just getting, yes, it's almost sunset.
it's yeah,
For you
it's quarter to
is
it's quarter to five here.
4:45. Okay.
You know,
So here is
my grandkids, they live in Detroit, so I think it's the same time as you, and they don't quite get it. I tell them
Western time.
if I call them around 4 o'clock or 5 o'clock, they say, it's just lunchtime here. And then
Yes, it's funny. So what
then
can we do?
you know my
Um,
my son lives in China, so it's well, now Mongolia.
Matthew,
Yeah, he lives in Mongolia.
he's still there?
But yeah, he's still there. And he so it's 18 or 19 hours ahead. So it's
Oh,
you have to add, let's see, it'll be almost 5 o'clock. It'll be 9 o'clock in the morning there tomorrow, um, Wednesday morning. So last year when we were watching the Super Bowl game, we're from Philadelphia, so that's our whatever. And so I was with my 7-year-old granddaughter, and I said to her, I said, your Uncle Matt's in Mongolia. It's Monday morning there. You can call him and find out who won the game. She goes, I don't think it works that way.
you have four
I have four.
grandchildren.
Yeah, four.
Yeah,
Three
four,
gir
four. That's
three
great.
three girls and a terrorist.
I have only one 1 year old. It's my life.
Yeah, yeah, they're
Imagine if I
fun.
have four. Oh my God,
Yeah, they're
dividing
fun.
my life.
They're fun. You're not supposed to have favorites, but the oldest is still.
Amazing. Oh, Joel is here.
Joel's here. Yeah, the gang's all
Missing
here.
you, missing you. Where have you been?
Well,
Good to
he's
see
right here. Where have you been?
you.
I'm always busy, busy. You see me everywhere. I'm
Yeah,
everywhere.
yeah, we're busy.
Amen.
Yeah, yeah, that's
So
that's great. No, I'm back. I'm back. It's so
nice.
Me and Dr. Clifford, even though sometimes for 6 months we don't see each other again. We're back.
Right.
You got
I've been
the
good.
you got the
I'm doing,
co-host, Joe. You got the co-host.
yes, I sure do.
Okay. All
I'm
right.
doing my best to take care of Doc.
Yeah, he keeps his eye on me to make sure I stay out of trouble.
Somebody's got to do it, right?
Somebody's got to do it.
Yeah, it's
So
always good to have a co-host in case problem with the Wi-Fi or
yeah, well, I
it's
don't know. It's all
not reliable.
just about every day at around 3 o'clock in the afternoon. It goes out. In the last 2 weeks, on our seminar here, it went out. Luckily, it
Wow.
didn't shut because I'm the host. And luckily, it didn't shut everybody out. But so I don't know what's going on over there. I think things are breaking down. It's, it's
Uh,
kind of like
I, I,
it's
I
kind of
think
like
it's,
kind of like society. I think I don't know.
I think it's big pharma. They're just trying to shut you down.
Again,
Always blame Big
Again,
Pharma.
again.
everything,
Who
everything's big
else?
pharma. Yeah.
Who else?
Yeah.
Well, we don't know. So somehow we think that technology brought us comfort,
So
Right.
which is great. I love it.
so
Now
you.
we are together. We can see each other from, all over the world. But
Mhm.
again, it's not reliable. There are times that in very sensitive situations, sensitive
Seems pretty
meetings.
reliable for our Filipino friends, though. So they this is, I think, the third week they've joined us here, and
Mhm,
we've had a nice crowd from them. So, and
mhm,
we're going to
mhm.
be hearing from them in the next couple of weeks. They're going to be doing some of the seminars. So,
Okay,
They,
okay.
they,
yeah.
they get away with stuff we don't get away with. And one of the experiments that's going on in the Philippines right now, Stefan Hartman knows a little bit about this. is lactoferrin and ivermectin is killing cancer at a pretty massive rate, but they weren't allowed to do it here in America, but they're allowed to do it in the Philippines.
I thought it was in the South Africa.
No, it's the Philippines.
Oh, okay.
Yeah. And they're on I can't think of the let me see if I can look it up. It's that, what is it? Viber. It's a group on Viber, and pretty intense group. In fact, they were just doing prostate cancer at first, and they were having such great results, they opened it up to other cancers. Pretty intense.
Hmm.
Yeah.
Right.
Okay, so the gang is all here coming in.
Yes, they are.
So, Dr. Burgess,
Hey, Dr. Burgess. Hi.
You guys, hello.
Hello.
Here,
You're
I'm-
back. We are back again.
I received so Dr. Burgess, I received an email yesterday from the American Osteopathic Foundation, wanting to know how come the American Osteopathic Society of Rheumatic Diseases hasn't made their contribution this year, and don't we want to have 100% participation?
Well,
By the way, Dr. Clearfield, your recording is on. Are you
No,
supposed to?
that's the whatchamacallit recording. That's not the one we use.
That's AI.
Yeah, that's the AI one. That one, I
Okay.
don't know how to shut that one off. We don't look at that. Okay. So that
Okay.
one gets
Because
that one
I'm
gets
sup-
that one gets dunked. That one gets dunked. No, we're the one that we use for the
for being here. So I'm trying to share my slide, but it doesn't go. Okay. So a little bit of my biography and organizations that I have in Canada. I'm Dr. Zarrin, founder of Homeopathy Nutrition Clinic, founder of Integrative Medicine and Nutrition, and founder of Bioquantum Academy. So they have been established in different years. And also I'm founder of an international educational platform for homeopathic diploma and integrative medicine. And the chairperson, head of scientific committee, and speaker at international conferences by Quantum Academy and some of collaborative global conferences. So if you want to know more about us, you can definitely go to our website and just visit different departments and see what we offer and what we do. So the conference is coming at July 12 to 13, and later we're going to discuss it. And so today I am going to share some of my, I can say, cured cases, but clinical cases with my homeopathic approach. And I would like to talk about my perspective and the philosophy behind it a little bit, and to know, because we might come from different concept, different background, definitely a lot of medical doctors in the house, and we all know that there are two different kind of perspectives that they can be extreme opposite of each other, but again at the end of the day we are trying to bring coming to a meeting point that we can help people. So in homeopathic perspective, homeopathic concept, we do not treat pathology, we don't treat the disease, we treat the person who is diseased. So that's a different than different the other modalities. So with homeopathic perspective, we is not a belief, is just a truth that there is only one disease, one internal disharmony, is we call it human disharmony, and with countless manifestation of the disease. So the manifestation of disease, such as the symptoms that diabetes manifesting, the symptoms that hyperthyroidism manifesting, the symptom of autoimmunity or whatever, these are not diseases. These are only one disease with different manifestations. So the reductionism approach and reactive medicine, in many cases, especially chronic conditions, chronic diseases, it's been failed. It's obvious. So no matter how much the science of biology, science of physiology is trying to find solution for that, but there is no solution, because that the healing ability is within the human body. There is no external effort. There is no external medications can help the sick to recover. Healing is an art of the human body, and its healing ability is endowed in all living beings by nature without exception. Every single human being has the same ability that is endowed in them. But the only thing that this ability has in a lot of time, from the embryonic time to now, is been suppressed, is been not supported, it's been blocked. So this healing ability has to be activated. So the best mechanism, the best tools, can activate this healing power. So far, I have conviction that the best mechanism and the best tools for activating this healing power is homeopathic medicine. Healing always follows the natural laws and principles, because human being is a part of nature. Nature's law is absolute, and deviation from these laws, violation of these laws is definitely not getting the human being to recover from anything. So homeopathy based on these laws and principles. A lot of science, a lot of aspects of science and art, principles, concept and everything. So it has to be explained fundamentally in order to fully understand how homeopathic medicine works. So your body with homeopathy can artistically, intelligently heal yourself with no effort when you remove the underlying causes of disease or internal disharmony in a timely manner, and restore homeostasis with the help of right mechanism, right tools, and administration of naturally derived substances that is called medicine. So medicine is the one that is activating this healing power. It is not medication. Medication is suppressing this healing power. That's the two different concepts that come into fight. So one is the contrary concept that we are going to suppress and to do anti-disease. Another concept, which homeopathy, we are going to do different way to treat the person with the similar disease. So every natural medical modality is a mixture of science and art. The same thing with homeopathy. The laws of nature is absolute, and nature never follows man-made rules. The human being never gonna respond to medications coming from outside. The human body is a manufacturer of everything you need, from hormone, from enzyme, from neurotransmitters. Anything you need is in the body. The only thing is just to understand how the human body operates, at all levels, physical, mental, and emotional level, and just give it the raw material, give it the raw conditions, and bring it into homeostasis. It's going to heal itself with no effort. So man-made rules, such as synthetic drugs or artificial inoculations, are the violation of the natural laws. But from the 125 years ago, that is happening, and it's still continuing. So healing is an internal domain and never follows external rules. This is absolute law. So, and we cannot violate this law. Homeopathy is a complete system of medicine that is the best choice for countless chronic diseases, for many acute conditions, for emergency, malignancy, infectious diseases, epidemic, pandemic, autoimmunity, and immunization. From the past more than 2 decades, I have been doing this with amazing results. So from cold and flu to cancer, I have been treating, and I'm going to share some cases with you then you can make your judgment. So having said that, but no medicine can do miracle without proper food and nutrition, based on everything, without proper personal hygiene, public sanitation, without pure drinking water, pure air, and a healthy lifestyle and environment. Definitely, these are something that we take into consideration. That's why sometimes I call myself integrative practitioners, because I take all this into consideration and to account. So this is I just want you to get to know my perspective about what I'm coming and what I'm standing for. And then I'm going to get into my cured cases. So homeopathy is the foundation of my practice, but I have integral approach. As I said, I take everything such as nutrition and different system of medicine that they are in a homeopathic domain, such as tissue salts, such as homeopathic organotherapy, such as homeopathic no-salt. These are all part of my integral approach. So let me just get to the cases. So these cases that I am going to share with you, these are my clinical approach. These are my clinical homeopathy. That these are like full courses. That some of altogether maybe there are 100 hours of courses that I teach at the Bioquantum Academy to especially actually medical doctors, because the one that they want to be classical homeopath, we know that they want to go with the constitutional medicine and a totality of symptoms and like cures, like we know how to teach them. But when it comes to medical practitioners, medical doctors, I created a different art for them. So it made it very efficient for medical doctors to bridge from allopathy to homeopathy very safely and gently and very efficiently. So what I use in clinical practice first is the classical homeopathy. So classical homeopathy is the foundation of my practice. It means we treat the person based on the totality of symptoms, with including all the dimensions, physical dimension, mental body, and emotional body. So we're not leaving out anything. No matter if the person comes for arthritis, person comes for diabetes, or any physical symptoms, we still treat the person as a whole. So with the totality of symptoms, the person comes to me for infertility. I dig into the mind, I dig into the mental state, and oftentimes they ask me, what's the relation between my emotions to what you're trying to do for me? And then I have to educate them. So because we are educators, we are not prescribers. So after the classical homeopathy, I do homotoxicology. Homotoxicology are pathways remedy, homeopathic pathways. I do for endocrine, it's an endocrine pathways for detoxification, for drainage, for support, for stimulation. These are, they do wonder. They're amazing. It's a branch of modern homeopathy for the endocrine pathways, detoxification, for organs activations, for system regulations and support. I do gemotherapy, which is falling into homeopathic domain as well, because they are prepared according to homeopathic principles. They are diluted. I use it for deep cellular drainage, for emontory cleansing, and I use tissue salts. These are homeopathic minerals, and because there is always the demineralization, especially in chronic diseases. I do a lot of trace minerals, oligo elements, definitely nutritional plan, healthy lifestyle, and teaching them the right environment. I just want to walk you through all this to get to know my approach. So in classical approach for totality of symptoms, as I said, I mentioned earlier, we look into physical, mental, and emotional all together. I personally, when I do the classical treatments, when the patient comes, sometimes it takes 3 to 4 hours case taking, because if I don't understand the person, I don't get to know the person, I cannot help them. So this is a very thorough and very detail-oriented kind of approach. And amazingly, when you understand the person, you can treat it and remove the disease in I cannot say no time, but very, very easy. So at homeopathy case taking, we're gonna find all the generalities of the patients, such as from top to bottom, from digestion, from sleep, from energy, menstruations, urinations, appetite, cravings, and then mental state. If if they have any form of anxiety or any form of constant emotions, and these are all taken into consideration. Again, we treat the person, not the disease. We treat the sick, not the sickness. So homeopath does not do diagnosis. We do not do diagnosis because disease is only one for homeopath, but manifestations are countless. Homeopath has to understand to find a matching similar remedy to remove the internal disease. We say similar, not exactly the same. And the terminology, all the medical terminology that is used in the mainstream medicine, which is absolutely helpful for allopaths, but has no use for homeopath because again, the symptoms of the person talking to us. So I have created my own piece of art on the science of homeopathy, which has made me to successfully treated thousands of patients around the world. The result has been astonishing to the point that giving me that much confidence and great tools to teach my personal approach to medical practitioners. But there are definitely obstructions to healings, the possible challenges that comes along in any modalities, and also with homeopathic as well. If the person comes, very in advanced malignancy stage of disease that is beyond healing point, and there is a very, very challenging case, which actually the cases that I'm sharing with you, they have been beyond healing points. So definitely I have been facing a lot of challenges in my practice with homeopathic situation in Canada, that a lot of medicine has been discontinued, that homeopathy has been attacked from left and right for the past 3 decades, and but somehow we kept it alive, and thanks to Health Canada for now, that is providing us the best system of medicine. So I would like to talk about this advanced cases, advanced pathology, I can call them. The very first one was large thyroid tumor and nodules. The second one, she was a 40 years old female. She came to me for infertility, that she had tried so many things, but she couldn't get pregnant. And the next one came with after the major stroke with a left side paralysis, seizure, vomiting, incontinence, and speech stuttering for 4 years. And the other one is advanced Crohn's disease, that he was 75 years old, and he actually escaped from the hospital, and right after it came to my office, and because they wanted to cut a big part of his colon and put colostomy, and definitely he just escaped from the hospital. Okay, these are the 4 cases that I can, if we have time, I can talk. What's going hard is it's not moving. Okay. Sorry guys, my slide is not moving.
Try hitting escape and then go back to your sort of
no idea what
other
happened.
field. Yeah.
I don't know why it's not moving.
Try.
Okay.
Okay.
It's okay. Also, I want to walk you through a little bit of my clinical approach for whoever wants to bridge from medical modalities to homeopathy. And this is the art that I created, after the classical case taking and totality of symptoms to come with the constitutional medicine according to the chief complaint, generalities, peculiar symptoms, modality of complaints, mental state, personality, everything that comes into understanding the patients. After that, I create different protocols. From the beginning of my practice, I learned that to create protocols for people, because there are times that classical homeopathy does amazing job, but it needs a little bit of kick as well. It needs some pathways remedies to open up the blockage of pathways much faster. So I most of the time, generally, I create 6 protocols for each patient, because the patients who are come to me, they're not coming for easy cases. They're all come to me after they're either rejected by other medical professions, or somehow is in the very last stage of disease. That's why normally I go up to 6 protocol for them. And always, it's very, very important to understand when to apply the protocol, when they should go on a break, when they should stop, when they should go back again on the protocol. These are something that I learned through my practice, and I studied a lot of, not only, I was not limited to just 4 years of homeopathic school. I studied maybe almost 12 years of homeopathy in order to really understand how what can help the person to recover faster. So these cases that I chose to talk tonight is, the reason is that I have permission from the patients to speak about them publicly. And their names are actually has been on the my website from the beginning. And also they are long time ago, like 11, 12 years ago, 10 years ago, because when it comes to, for example, cancer patients, if it's just 2 years ago or 3 years ago, and everybody says, how do you know if there is no recurrence? How do you know the cancer is not bad? So I chose the cancer patient that after 10 years, 11 years, there is no sign of cancerous cells. So, and also I chose the advanced pathology. It means that they were rejected even by their medical doctors, that nothing works for them, because they have gone through many different treatments with no results. And also they were very determined to come on homeopathic treatment as last hope and with convection. So the very first one is large thyroid tumor and nodules. She was 62 years old in 2013. She is a mother of 3 children. Lost her brother to cancer. The cancer was running in her family. Nephews, nieces, they died from cancer. And she was so panicky when she was diagnosed with malignant tumor. And as some of you know that they tell them, you have to go either through chemotherapy or radiation. But this case, they told her from the beginning on a spot that you have to remove your thyroid gland. So she was devastated. This patient came to me years before that. It was about 2006, 2007. She came to me for a recurrent urinary tract infection. As she explained to me, she had been on almost 18 different antibiotics, antifungal, antiviral, and nothing worked. And every 6 weeks, every 2 months, she was having urinary tract infection recurrently. And to the point that her medical doctor asked her to go and seek for some natural therapies or something. Nothing works for you. And she was devastated, and she came to me. It was, as I said, I don't know exactly what, 2006 or end of 2006 or beginning of 2007. And she came to me, and in only 3 days, she recovered. And even though myself, maybe it was my first case of this long-term urinary tract infection, I did a lot with children, younger, patients, but not chronic like that, because she said it was over 5 years and she was having so much recurrency. And every antibiotic she tried, and then she came up with a fungal infection, and again, viral infection. Anyway, she recovered after just a few days, because when she came to me, she had bleeding, in urination. So everything kind of settled. And after 6 weeks of treatment, she went and there was no sign of infection. And I think that was the conviction for her. And when she was diagnosed with a tumor. But prior to this, from a young age, as she explained to me, from young age, she had nodules. She had thyroid nodule, but they told her this is nothing. But somehow the nodules started, duplicating, started getting more and more. And then one tumor came. And the ultrasound showed that thyroid right lobe measuring, that the number that you can see on the screen, and the midpole of the right lobe measuring 1.7, 1.3. I don't really understand the allopathic, readings, but again, that's how they came up. The result came. She brought all the test results to me, and that's what I found out on the results. She was urged by her family physician to remove her entire thyroid gland because of the chance of malignancy. They told her that is malignant already. And she was so scared. She was so devastated because she lost her brother to cancer, niece and nephews. And she was so scared, but somehow she didn't want to remove her thyroid. So biopsy result was in 2013, suspicious malignancy in all tumors. She asked her physician, her doctor, that she wants to consult with her homeopath. And her doctor said, you're putting yourself into danger, because this might be progressive, that your life is in danger. And she advised against seeing a homeopath, because they told her that your situation is very risky. So I took her case. She came to me with, as I said, she was devastated, and she asked me what I think. I said, I'm not in a position to decide for you, but absolutely it's up to you what you want to do. She with conviction, she said she does not want to remove her thyroid. But she asked me, what do you think? I said, the only thing I can say, I could help you, but this is very slow progress. It's not like a urinary tract infection that in 3-4 days you can see improvement and you see bingo. And this is a thyroid tumor, and it takes time. And if you're patient and you're confident about not going for that kind of invasive treatments and removing your king of metabolism, your one of the main organs, it's absolutely up to you. So she said no, she doesn't want to remove the thyroid, and she doesn't want to go on any form of medications or treatments. So that was her absolute decision. But again, because of her treatments with me prior, and also 2 of her children with me, it's kind of, she was confident about it. And I took her case classically, so in the classical approach, and with all generalities, I about digestion, about energies, about sleep, thirst, urination. She was postmenopausal. And I focus on her mental state, because that's how my classical approach is. If I take 10 rubrics for one patient, 6 of them are mental state. I dig into the mind, because that's how it's leading me to understand the patient. So the mental state exactly, she explained to me, and I observed her for years that she was my patient. She was very passionate, she was very intense, she was always seeking for an outlet, to take the intensity out. She was having some suspicion, some kind of envy and jealousy. She was suffering from paranoia as well. And I saw aggressiveness in her, like great loquacity as well. So anyways, these are the very kind of the key like a leading symptoms for me to really understand the patient, in addition to the physical symptoms that she's manifesting. So the biopsy result test was in the month of June. As I mentioned, suspicious malignancy, it was in her tumor and nodules. She asked again her family physician that she wants to consult with me before going on any allopathic treatments or surgery. So understanding my patient's psychology due to fear of cancer and fear caused by her physician, I gave her my full support, taking all the recommended allopathic tests if she wants, without worrying of me rejecting her. I said I would never reject anybody. If you wanted to keep going and doing the test, I would support you. But as long as the fear does not cause any problem, with your treatments here. So this is something that I faced from the beginning, not anymore, but in the beginning, that was the challenge I had in my practice, that, some medical doctors, they did not allow, some of them, they did not even allow them to come to me or to come to anything. At this present moment, it's not, it's easing off. It's very, some of them actually very supportive. And, but back then it was a big challenge. So the classical approach brought me to understand the person, and her constitutional medicine was Lechesis muta. The Bushmaster is a snake poison. So it comes, this homeopathic medicine is a polycrest homeopathic medicine. It's a very powerful homeopathic medicine. Homeopaths should be very careful to use this homeopathic medicine. It does wonder, but if you do it wrong, it can do very damaging as well. I mean, if the person goes, for example, through aggravations or goes through proving, it's very hard to ease off those, aggravation symptoms. But this is a very powerful remedy. But that was, it was in my surprise, homeopaths normally finding similar homeopathic medicine to the picture of the patient, not the same. But this one, it was more than similar. It was more the same. So most of the time I do differential diagnosis between 3 different medicines. They're very close to each other. They cover the same symptoms. They cover the same areas, especially in polycrest medicine. But this time I did not have to do differential diagnosis between the medicine. It was just right for the person. So I gave her Lechesis 200 CH, and for 2 times a day for 3 days, then once a day for 4 days, total for 7 days. Then that's my approach is, after the classical homeopathy, go on a break, sometimes 1 week, sometimes 2 weeks, because the polycrest homeopathic medicine works 50 days in the body sometimes, and sometimes gets exhausted a little bit earlier, but to be cautious, I always ask them to go on a break. So homeopathic polycrest medicine is kind of repairing the vital force. First, with the constitutional remedy, I try to repair the vital force that is being poked by the disease agent. So, and then I do the rest of the treatments, which are the rest of the protocols. So lachesis, again, it's a snake poison. It's a very powerful medicine. The characteristic of the lachesis medicine is passionate on all fronts. Very, very passionate people, very intense people, very talkative people, arrogant people, extroverted people. And they have a lot of paranoia. They have a lot of phobic. They have a lot of anger. They have a lot of revenge, fear, and all these things gathered in one medicine. And the picture of the medicine matched perfectly with the picture of the patient. So that doesn't mean that the person is, if they has these symptoms or has this characteristic, is a bad person. No, actually they are very, very passionate people. But because of all these symptoms, they are suffering from inferiority complex all the time. So I have seen it in a lot in lachesis people. And at the physical level, they have hemorrhage, they have a lot of discharges, they have hot temperature, hot flashes, menopausal aggravation, and I saw it in the patients. And most of the time, the symptoms, the modalities of the symptoms started from left side and then moves to the right side. A lot of purplish discoloration, in many cases, lachesis, they have hypertension. And and they have, most of the time, they have aggravation in 2 seasons, spring and fall. So, and lachesis covers big areas of neurological system. It covers the throat area, gastrointestinal, urogenital, upper torso, the chest, and a muscle and bones, and a sleeping pattern. These are the indication of this medicine that I looked into it. So after the classical approach, after the classical medicine, which was lachesis, I get into my protocols. So after 7 days break, the patient comes back to me, and then I put them on the endocrine pathways medicine. In thyroid conditions, no matter is hyperthyroidism or hypothyroidism or Graves' disease or Hashimoto's disease or whatever it is, my approach is adaptogenic approach. In classical, in homotoxicology, in nutritional plan, everything, no matter what, I have adaptogenic approach. So after repairing the life energy or vital force collectively with the constitutional remedy, it's time to open up endocrine pathways, to repair systems, to repair organs and tissues individually by homotoxicology medicine. According to the evolution table of disease, that starts from the benign and goes further and further and becomes more malignant. According to the table of the disease, I choose homotoxicology for the patient. It was a very hard thing in the beginning to do, but as I said, I trained myself a lot to really understand the phase of the disease in the patient. So yeah, definitely when they come with tumor, this is it's beyond degeneration. It means it's an advanced phase of disease. But as long as it has not into the differentiation, it's still doable. So according to this table, I choose preparations. I choose homotoxicology preparations, or you can call it biotherapeutic. These are all homeopathic preparations. This time for the tumor and nodules, I chose a preparation that had nausea. The nausea is also, again, it's a snake poison. And it comes from the cobra snakes. Acidum lacteum and Spiropholaria. These are all low potency, low dilution. They're all coming in like D4 or D2 or D8. This is amazing combination in homeopathic homotoxicology for tumor and nodules. I have used this combination a lot for benign nodules with benign, indurations, or even for malignancy. For cellular degeneration in cancer support, I use another combination that included Tuya, Orometallicum, Plumbum, Lycopodium, Arsenicum album, Calendula, Juniperus sabina, Condorango, and Argentum metallicum. This is again, it's a wonderful combination of homotoxicology, homeopathic medicine for cellular degeneration in cancer, especially in cancer patients. The patient with the tumor had osteoporosis as well, in addition to the treatments for the tumor and nodules. I also gave him osteoporosis preparation as well, because the diagnosis was 33% of losing bones in the hips, and he was in a very agony pain as well. I gave tissue salts, which is homeopathic minerals. I call them the healing salts. I gave her silica, calcarea phylorica, and calcarea phosphorica separately, and also a combination of 12 tissue salts as a tonic, as a mineral tonic, because cancer patients are very demineralized. So I showered her by homeopathic minerals. So the homeopathic minerals are in a very low potency, and in acute conditions, I use like a 3x. In semi-chronic, I use 6x, and in a very chronic, I use 12x. For these patients, I use 12x. 12x is more diluted, but it's more potent. That's how homeopathy works. The more diluted, the more potent. So the science of homeopathy proves that. So I use oligotherapy. I gave her iodine. I never give a mega dose of minerals. I always go with the nano size, small, such as tissue salts, homeopathic tissue salts, or trace minerals. I gave her iodine through the treatments. I gave her iodine, selenium, zinc, copper, calcium, and magnesium, only in trace level, trace minerals. So also the combination of trace minerals such as manganese, copper, cobalt for hormonal homeostasis in thyroid insufficiency. I gave her multi-oligo minerals. As I said, I showered her by minerals. I gave her that multi-oligo once, not all the time. Gave her once during the treatment and once after she completely recovered during the maintenance. So I also use thyroid cellular deep drainage with gemotherapy. As I said, gemotherapy are amazing system of medicine. They're prepared according to homeopathic dilution, Rosa canina 1D dilution, and Cornus sanguina 1 dilution. I give it to her. These are amazing gemotherapy remedies for adaptogenic approach to all thyroid conditions. And also food that I can explain it to you later. Let me just get into the case, and then I'm going to come back to talk about nutrition that the nutritional plan that I designed for her. So these are the diets. Okay. Then I gave her all the nutritional plan, gemotherapy, tissue salts, homotoxicology, and the pathways remedies, and also the classical homeopathic medicine. The first follow-up, she came to me, was November 28th. The first follow-up, cancer cases do not need frequent follow-ups because the treatment is not as slow, but the progress is as slow. The process is as slow. So that's why the process of, because cancer patient is in the degeneration phase of disease, it needs a very, very deep further into the body, and it needs to be rewinded, very slowly to get back to the time that didn't have tumor. So it's a very slow process of healing. I retook her case again because every time that patient comes, I take the case again to get to know her mentality and any improvements. But when it comes to tumor, the patient doesn't know about improvement. The only things that she can explain to me how she feels generally, compared to the very first time she came with that, she was very intense. She was with paranoia, so much anxiety, so much, kind of anger. So this time she came to me and she said she's feeling better generally and mentally. And she has no fear of cancer or fear of dying. She was constantly telling me that she has fear of dying before lachesis. And I just wanted to know the effect of lachesis on her. So she said she has no fear of cancer, she has no fear of dying, and generally she's calmer and she's at ease. I asked her to stop the protocol for 2 weeks because normally I give break because I just have to see how the body works without stimulations, without all this medicine. So then continue the protocol, but reduce everything to 3 times from 3 times a day to 2 times a day. So normally I start with 3 times a day with like homotoxicology, but I ask them to reduce it when they feel better generally. When you feel better in terms of mental state, your physical body also is going to go at ease. So I did not repeat lachesis this time, the constitutional remedy. Between this time and the next follow-up, I had 2 like a very quick follow-up with her, and I was informed exactly what she's doing. She was following protocol correctly and precisely. She said she's feeling more relaxed and positive about her recovery, and she has no worries. This was enough for me to continue with her confidently. So the second follow-up, that was the main follow-up. Normally, it's up to now, I had almost 4 follow-up with her, just 2 small follow-up in between, but I did not record anything because she was feeling okay. I repeated lachesis this time again for another 5 days, once a day for 5 days. And I asked her to continue the initial protocols, the integral protocols I instructed, with endocrine pathways remedies, and also continue the diet and nutritional plan. So at this time, I started giving her a little bit of female support, a little bit of female supplements, such as physioxet, such as Minolistica omega-3, to just give, because she was not a good eater at all. As far as I know her, she wasn't eating so well. And at this time, I said for a period of time, maybe 6 weeks, it's good to have nutritional supplements to help her recover faster. The third follow-up was March 13. She had new thyroid ultrasound test result in. So the test result, the right lobe size was smaller. To me, was not that much smaller, but the doctor told her it's smaller. But when I compare to the original one, it wasn't very significant, smaller. The reason is, for me, the size of the tumor is not a big deal because homeopathy does not work on the margin of the tumor. Homeopathy works from the nucleus, from the center of tumor to out, to inner, from inner to outside. So for me, it doesn't matter the size. And I explained that to her. I said, listen, you might go for 10, 20 different ultrasound, and they still tell you that tumors are still there. But the tumor is going to be numb from within. They cannot detect it. We are, with homeopathic medicine, we try to cut off all the supplies, the blood supplies, the food and everything from the center, because the livelihood of the tumor is in the center. So that they cannot detect it through ultrasound or any other devices. If they see the tumor is still there, just trust me that we're doing something here. So, but again, she came with the result that is a little bit smaller. 3 hypoechoic nodules were still detected in ultrasound. So 3 nodules that they were bigger were still detected in ultrasound. And no significant cervical lymphadenopathy was seen. And I asked her to continue the same protocol, don't change anything. But this time I did not give her the constitutional remedy, because constitutional medicine should not be repeated more often. It should be repeated only when the homeopath sees that the medicine is exhausted. If it's still, she is still, having the same improvement mentally, emotionally, we don't have to repeat it. So I did not repeat it. The 4th follow-up. So during this time, I always try to educate her about how homeopathy medicine works, and not to be afraid of any report of biopsy or ultrasound if they keep telling you that the tumor is still there. So there was a new technology back then came in, and they asked her to have a new biopsy with the new technology. This time, there were 2 nodules detected, not 3. One of them was disappeared. Somehow they told her that there is one of them is no longer there. 3 of them were very big. She had several other small ones, but 3 of them, they were big, and 1 big tumor. But one of them was disappeared. Biopsy result this time shows no malignancy confirmed. So the very first biopsy, they said malignancy. This time they said no malignancy confirmed, but doctor not sure yet. She told her that the doctor told her they're not sure yet, but the biopsy shows no malignancy. So I asked her to just continue the protocol, don't stop. At this time, I do not give the patients, especially cancer patients, I don't give homeopathic organotherapy. Homeopathic organotherapy is for organ stimulations, such as thyroid or adrenal glands or hypothalamus or pituitary. So at this time, I do not give organotherapy, but at the end of the treatment, I started giving her. So we don't stimulate the organs that is still battling with, tumors or nodules. So the 5th follow-up, tumor and nodules were not detected. October 23rd, 2014. That was the 5th follow-up. Thyroid ultrasound result was in. Comparison made with most recent ultrasound, including biopsy in June 19, 2014, and previous ultrasound in March 13, 2014. Size of the right lobe of thyroid was normal, and no tumor and nodules were detected in ultrasound. They were not detected because thyroid endocrine specialist called my patient in and reported that tumor and nodules are numbed. Numb in tumors is allopathic language, means not detected. The specialist returned the patient's file to her family physician for no more visits. She came to me for the 6th follow-up, April 29, 2015. That was annual thyroid checkup by family physician. Cytology to report normal, no more nodules or tumors detected in new annual ultrasound test. Next biopsy test was scheduled in 6 months but got canceled. Tumors were numbed in less than a year. they could not be detected by sound resonance detector. Margin was still showing in ultrasound for a while, but the mass was known. That was the exact explanation that I told my patients, and I sent it to the specialist. That's how homeopathic medicine works. You might see the margin of the mass, but the mass is known. My explanation to a specialist was, by homeopathic treatment, tumors and nodules are destroyed from the center of the mass, not from the margin. Seeing the margin in ultrasound cannot confirm a tumor during homeopathic treatments. Tumor and nodule were completely deteriorated in less than 14 months. No sign of tumor and nodule, and they never returned to this day. She and her entire family have been under my treatments for various conditions since her full recovery to this present day. Actually, I visited her just a couple of days ago. She never went back to her family physician or a specialist for any condition to this day. So from 2014 to 2024, cancer-free. So I would like to go back to the, if you like to know about the diet, that's the food to avoid in any form of thyroid conditions, to avoid goitrogens, the food that they have glucosinolates, that they are goitrogens, such as cruciferous foods, such as arugula, kale, bok choy, broccoli, Brussels sprout, cabbage, cauliflower. All this family, I ask her to avoid, not only for short period of time, I ask her to avoid for almost 9 months, because no matter it's hyperthyroidism, nodules, tumor, or any form of thyroid condition, I ask people not to use this food, even though they're amazing food, they're full of minerals, they're delicious, but unfortunately, because of this component, chemical compounds they have, they are they're kind of binding with iodine and interfering with the pathways of the hypothalamus, pituitary gland, and thyroid for iodine reuptake. So, and also I ask her to avoid the nightshade family because of alkaloid chemical components, and such as tomatoes, eggplants, potatoes, pepper, tobacco. These are also in a family of, you call it nightshades, right? We call them inflammatory food. So we try to be as easy as possible on the body and not to mount any immunological responses during treatments. So she was very precisely following the diet as well. And what I do always for everybody, to go on a genetic diet, to go on a blood type diet, which I have been doing it for almost 30 years since I became a nutritionist. I've been on a blood type diet, and it does wonder in so many cases, especially chronic cases. And definitely, I'm sure that nobody likes my recommendations here, that even though the wine is a great source of polyphenols, but they are iodine chelators. So wine, it's an iodine chelator. So that's why I ask my patients to avoid drinking wine during the treatments, because these compounds are capable of fixing iodine at the second stage of hormonogenesis from the pathways of hypothalamus, pituitary, and thyroid pathways. So even though polyphenols is an amazing, kind of antioxidant, but again, in a thyroid situation, I ask my patients to stay away. But luckily, my patient did not drink wine at all, so we didn't have any issues with her. So this is my thyroid case. If you have any questions, or I can go to the second case.
I have a quick question on the diet. I see a lot of the things that you had her avoid. On the diet that you put her on, was it more of a ketogenic type of diet then?
Mhm. Which one, sorry?
What kind of diet was she on basically? Was it a ketogenic type of diet?
No. She was on a blood type diet. She was blood type O, and I put her on a blood type O diet. Like blood type O diet, they're like a protein eaters, protein and vegetable eaters, and they're not dairy product eater. They're not, they're not supposed to have a lot of wheats or carbs. This is something that it's a general kind of diet. I put almost all my patients on blood type, and she was blood type O, and she precisely followed blood type O. But these are different. That's mostly for thyroid condition. I ask them to avoid because they're the goitrogens. So avoiding all this food is helping a lot to open up the pathways and put the body at ease and
Can I
improving.
ask what the percentage is of protein compared to fats and carbs?
Sorry, percentage of protein?
Proteins compared to carbs and compared to fats. How much protein? I mean, was it like, a 60, 70% protein and 10, 20% carbs, 10, 20% fat? Or
okay. Homeopaths do not go with percentage. So we don't go with percentage, but the blood type O, generally, as I said, this patient was blood type O. They're protein eaters. So
protein would be carnivore, right?
Yes. Protein eater. The protein can comes from plants, can comes from animals,
Right.
But they can, they have to have high protein. So, but very, very low carbs, but high vegetables, high protein, high vegetables.
Agreed.
And
Do you worry about oxalates from the vegetables by any chance? Or no?
No. Why? When protein and vegetables, they're like each other. So they digest each other. They very help each other digest, and they're great collaborators in terms of food. So there is no problem with that. And the fat, I'd never recommend any fat. The fat comes with the protein. I think that would be enough for. But the only thing that sometimes people that they don't have enough omega-3 in their diets, they don't eat, fish enough. So I may just ask them to have a little bit of supplements of omega-3 just for a very short period of time.
Except for people like myself who have what's known as lipodystrophy. So I don't produce fats. So I actually have to get my fats outside of everything else. And so I devour fats. I can devour fats like you. I'm given fats at restaurants throughout town because they know that I need the fats. And I devour avocados at the same time so that I can, sustain my lipodystrophy. So besides people like ourselves, we need to obtain the fats outside of regular sources. So I understand what you're saying. Appreciate it.
Yeah, you're welcome. So
I have a question. Was there other pathology in the thyroid tumor? Did she have also things with uterus or anything else, or was it just localized in the thyroid? I mean, when you gave the lachesis, were there other things that were helped by that repetition? And the second question was, I was curious how you went between C12 and C200. For maybe high vital energy with 200, but the 12 is usually for chronic. How did you do that? Alternating. How did you decide of the alternating between those two potencies? Thanks.
Okay, great question. So first of all, she did not have any other issues rather than urinary tract infections years before. But she didn't have any problem like in regards to reproductive system or infertility, or no, she didn't have any issues. So Lachesis was chosen based on her mentality, based on her mental states. And and she was a great match, and Lachesis did wonder. I don't choose animal kingdom, homeopathic animal kingdom, low potency. I never go Lachesis 12 CH. So the minimum I go is 200 CH, but I have gone to 10M as well in some cases. Like after 200 CH, I go to 1M, 10M, 50M.
I was just curious, do you also use Q potencies?
Pardon me?
Do you also use Q potencies?
Q? No.
Q.
No, I don't. I chose to stay with CH from the beginning. That's how I learned at the school, and then I practiced it for more than 2 decades. I don't change potency. I stay with CH. And with the tissue salt, I stay with X. And with the homotoxicology, I stay with D, decimal. Centesimal with the constitutional, what you call it, single remedies. And homotoxicology, I step with D, decimal. And with tissue salt, I stay with X. So that's how I have been trained, and it's been great so far. So the other potency, I don't know. I never worked with.
Do you also sometimes alternate also with, I asked the questions on the chat, so placebo, or also, I didn't ask, but like mother tincture, I don't know how you call it because we speak German in Austria, but do you also use those kind of things in your cases?
I do not use mother tincture. No, I use strictly homeopathic dilution. Mother tincture is a crude form. It's not diluted, it's not potentized, and I never use that. Even when it comes to gemotherapy, I always use the diluted. I always use the minimum dose of everything, because mega doses can be very damaging in so many cases. No, I don't use mother tincture. That's your question. And I think you had another question.
I don't remember anymore. Thank you. It's 3 in the morning in Austria. Thank you.
Okay. If Dr. Clearfield can read the questions, if
Sure.
I can answer the questions, because honestly, I cannot reach out to the chat.
Okay. We got it for you. Okay. Is there a correlation with this treatment and patient's fear of snakes?
Yeah. Yes. The fear of a snake is the manifestation of the very deep phobia of the patients, and that is being trapped in the in the body for God knows how long. So fear of a snake is an indication of Lachesis, but I did not choose. And actually she had. That was just a little bit of confirmation, but I did not choose Lachesis based on just fear of a snake. But yes, is an indication of Lachesis.
I think the question was that a coincidence, or is that something that you used to sort of, point to that remedy?
What do you mean coincidence? So
the coincidence, just a coincidence that you used Lachesis and that you had fear of snakes.
No, fear of a snake is one of the characteristic of Lachesis. So any material medical you check, you see fear of a snake is one of the indication of Lachesis, but not necessarily all the Lachesis patients they have fear of snakes. No, that's why I do not choose Lachesis based on fear of snakes. But if there is all the characteristics match and the fear of a snake is there, it's a confirmation for me. So And with this case was. So, but again, I didn't choose the cases only based on that. So, it's,
Mhm.
yeah.
Okay. Another question is iodatum, or were any tissue salts additionally used regarding iodine?
Iodinum?
Iodatum.
I didn't get the question, sorry.
Were any other tissue salts used regarding iodine?
Oh, tissue salt doesn't have iodine. Tissue salts are 12 tissue salts. The iodine is not included. That's why you choose oligotherapy that has iodine. So iodine is not in tissue salt, is in oligo elements.
Okay. The question was, there's a question of, do you occasionally use placebo in your cases?
Oh, no, I never use placebo.
Okay.
I never ever use placebo, and I directly go and treat the person. No, placebo. No, it's just.
I'm just asking the questions here.
It's a clinical trial, so this is not a clinical trial.
Okay.
It's just people coming to get treated.
This patient had a very high vital force. It seems to use 200 remedies. Or why was there an alteration between C12 and C200?
I think she already asked this, right?
You did? Okay.
Yeah, she already asked this. So there is a huge difference between CH12, 12CH and 200CH. So by the way, when the lower the potency, the more works on a physical level. The higher potency works on a mental level. So that's how homeopathy works. If you want to treat the pain in the joints, just as a keynote remedy, you go with the lowest potency, but more repetition, more frequency. But if you want to treat the person at the mental level, mind level, you go with the highest potency. So that's the difference between physical and mental.
Did any of these remedies also help her uterine complaints? Isn't there a relationship between the thyroid and uterine situations?
Not in this case. She didn't have any problem with the reproductive system. She had problem before with urinary tract infection, but not with the reproductive system. And she was menopausal. So she was 62 years old, and she was postmenopausal actually, and she didn't have any issues with that area.
Okay, this is more of a statement. Farouk Master also has a very interesting book on homeopathy with snake remedies to differentiate between different snake constitutions.
Yeah, Farouk Master, he is very keen on that. So if you want to know more about animal kingdom in homeopathy, especially snakes, yes, he has a great book as well. So.
Dr. Wolf states the Lachesis representation chooses the remedy based on symptoms, mentals, fears, and dreams.
Yeah.
Okay.
If the picture of the patient match with the characteristic of the medicine quick enough, I don't have to go dig into more, such as a sleep, such as a lot of the dream. Sorry, I don't go that deep if it's already there, is already matched. But if still, still I need more information. Still, I want to know deeper pathology in the person. So I may ask about the dream, like especially recurrent dream. But sometimes it's not necessary.
Okay. Iodine is also in high concentrations in the sepia remedy.
In sepia?
Sepia, yeah.
Sepia, I am not sure about high concentration of iodine. The high concentration of iodine is spongiatosa. Spongiatosa is one of the homeopathic medicine. Actually, my PhD research was on that for the weight loss. It's one of the highest contain iodine in a materia medica. It's spongiatosa, but not so much in sepia.
Okay. Do you also use bioresonance as that's the question.
I use biofeedback.
Okay.
Yes, that's how I test my patients. Yeah.
Okay. Just to mention, Dr. Jens Worster's book on healing of advanced tumors will be out in English soon. And Farouk says the dream can be used similar to the patient's delusion. Just a comment in case you're also look about the patient's primary mental delusion when determining your remedies.
I'm more trained with European approach than Indian approach. I think every continent, they have their own approaches. I'm very much prone to more European. I'm very Hahnemannian. And so I don't get in too much into delusions. I'm not an expert on it. If somebody is an expert on it, somehow I don't understand it much. But the Hahnemannian approach, I think that I adapted is the best one for me. And so far, because the rate of success in the treatments is just a testimony of the right direction.
Okay. It seems like you used quite a few remedies there. I mean, were they individual ones or were they bundles? How do you go about, the practical day-to-day use of them?
Which one? Dr. Clearfield, you didn't make it clear to me.
If you go back a couple slides where you went through, keep going back. Keep going. Wait. Okay. Go forward one more. Yeah, like here, like these 12 trace minerals. I mean, is this all one?
The trace minerals, these are oligo elements, right?
Yeah, it's all one.
The multi-oligo is contains 12 trace minerals in combination.
Okay, all right.
All in one. But again, when it comes to multi-oligo, we don't have to repeat it. We can give it once. And then I don't give a lot of, don't repeat it more often. So, but I give to this patient once during the treatment and then after she completely recovered during maintenance. So.
Okay. Anybody else have any questions on this case? So, so it's about 6:30 our time. It's 9:30 your time, Dr. Zarrin. You want to keep going with at least one more case? Or you?
So, it's up to you.
I mean, we're good. We're good. We still have a pretty nice crowd here. So.
Okay. So, do you want to know about a case of infertility, or do you want to know about the case of a stroke?
Whatever is your favorite.
All recovered.
I got a message from a new guest here. They said infertility, so there you go. Okay.
Okay, infertility. Okay. So I may just at the end mention quickly to the stroke as well, or I can do it next.
We might have to have you back. So we'll see how it goes.
Might.
So go for it. Go for it.
Okay. So this is a infertility case. So she tried so many different treatments. She was 40 years old and they didn't found any abnormality in her test, pap smear test, monthly cycle, hormonal system. She didn't have any problems. So Nothing abnormal in anatomical and physiological reproductive system, but no pregnancy for years. And these questions, she kept asking this question, if everything is normal, but why I cannot get pregnant? So this case proves that biology and chemistry is run by the vital force or subtle body, and not vice versa. So this is an interesting case. I took her case again, initial case. Her menstruation was normal, last 7 days. She didn't have any problem. Digestion was okay. She just had a little bit of chronic colitis, time to time. Her sleep, appetite, energy, body temperature, everything was, she reported to me normal. But urination and thirst, she complained a lot. She said that she has high thirst and she has frequent urination. Again, I went through the mental state, so she was a little bit religious. I don't know, spiritual or religious, but she had a lot of fears: fear of water, fear of drowning, fear of suffocation, fear of dark, fear of animals, fear of ghosts, and she thought that the ghost was real. But she explained that she had a great childhood. She was loved by her parents. She didn't have any problem growing up. Physical symptoms: she had shortness of breath. She said she gets worse in the summer because of heat, and she had constant high thirst. That was her very, very complaint, that she's thirsty all the time. So she reported some, pathology such as anemia, actually she was chronic. She always had a low iron level, and she had a congenital prolapse of the mitral valve, and also she had rhinoplasticity. So these are the physical symptoms that she had. I took her case as normal. I asked her to explain about, her life and everything. So let me just here. Okay. She talked about death of her young brother, death of father, divorced her first husband, and she was constantly worried about her mother, that she's alone because the mother lost her son, her husband, and she was not content in her second marriage as well. She couldn't get pregnant. She was a very reserved person about to share her problems, and she was internalizing it, but very affectionate, overall sensitive. And as she explained to me, she was forgiving, get along with people. She's sociable, but very private. And she was very, very sweet and very nice during case taking. But she answered my questions very, very cautiously. Sometimes she was pausing to answer the questions. And so somehow I tried to, because some people, they're very, very private, and no matter who the cancer, doctor is, they cannot open up that quick. And so she asked me, why do you keep asking me about my life? I said, I just want to know you, because I'm not treating your infertility. I'm treating you. If you're treated, then, your disharmony is going to be removed. So she had heavy, long-term trapped and suppressed grief because of, she was trying to show herself very strong in front of her mother, because the mother lost son and husband. And she was also, had divorced from her husband. She went back to her mother. There were just two of them. She kept herself very strong, not to show any emotions in front of her mother. She thought that she's supporting her mother. So it was heavy, that suppressed grief. By understanding her suppressed grief, then led me to the right remedy for her. I said, this person with long term grief is infertile. So infertility is not the disease. Her infertility is the manifestation of a chronic internal endocrine disharmony by the charge of the grief. Emotions are not biochemicals or electrochemicals interfering with the current electromagnetic field throughout the body and affect an entire body physiology. So that's why the charge of the grief should be neutralized immediately. The grief is going to stay as long as it's supposed to stay. But the charge of the grief or the charge of emotions, charge of trauma, everything, it should be neutralized, which we do it with homeopathy, such as Ignatia Amara. So Ignatia Amara, I always have it in my purse that if there is anything that happens, so immediately, I take a dose to just neutralize the charge. The incident, the problem or whatever we face, it's still there. We're going to deal with it. But the charge is not supposed to interfere with our electromagnetic, because the negative charge of the emotions can entrap the ionic level. Charge of grief should be neutralized immediately. Long-term effects on biology and physiology of the endocrine pathways causes disharmony. So emotions, when on the onset of whatever happens, is survival. It's a survival mechanism. When you become fearful, if you're chased by a lion, you run, right? And it's creating some form of fear because it's a survival mechanism. When something bad happens, you get depressed or upset or whatever, is somehow the body tries to bring you in a hypo state in order to deal with it. But body has to come back to the natural, natural harmony and balance on a timely manner. So because the interference with the body electromagnetic field, if it's in a long term, can cause a lot of malignancies. And this not everybody might know about this, but emotions, if it's trapped, especially grief, if it's trapped for a long time, can cause malignancy. Emotions are not chemical structure, but electrochemical responses to internal biochemical changes in internal equilibrium and homeostasis. Emotions interfering with current electromagnetic throughout the body. Emotions are survival at the onset of any incident, but should be gently supported, not suppressed. Supported, not suppressed. We do it by homeopathy. Should be dealt with on a timely manner, not to become chronic grief. Should be directed and neutralized in a healthy and safe manner, not to be blocked. Homeopathic grief remedies are the best option to help this process. Ignatia Amara, Natrum muriaticum, Orometallicum, Phosphoric acidicum, these are all grief remedies that, according to the case, we recommend it to almost everybody. You can even use it as a keynote remedies in grief situation. Like Ignatia Amara is a very acute grief, but Natrum muriaticum is an old and chronic grief. So, as I said, emotion can be vital protection in onset of the case, but again, when it becomes chronic, it can be very, very destructive. Emotion gives us power to take action, to strive to survive and avoid danger, to make decisions, to understand surroundings, understand others. Again, they should not be suppressed. They should be directed. So, electric charge of emotion should be neutralized immediately in order to get back from emotional mind to logical mind. But the process of emotion should never be suppressed or blocked. So the way that my patient did, she completely suppressed her grief, not cry. She lost her brother, she lost her father, she lost her husband, but she didn't want to cry. She didn't want to show any emotions. And she completely internalized everything for years, not to show her emotion to her mother because she wanted to support her mother. Symptoms, no matter physical, such as pain, or mental, such as anxiety or grief, are the manifestation of one internal disharmony. So let me just go directly to the patient. As I always say, we treat the person, we do not treat the disease. So that's the explanation that I gave to my patient. I said, listen, I'm treating you, I'm not treating your infertility. So I'm treating you according to your, the totality of symptoms, according to your all dimensions, physical, mental, emotional. And then infertility is going to be removed on its own. So no homeopathic medicine is indicated for infertility, but to treat the infertile person. The holistic approach, neutralizing emotional charges, repairing vital force, body dimension alignment, restoring balance and homeostasis, restoring endocrine system harmony. These are all that we do during homeopathic treatments. So what I gave her was Ignatia Amara, 200 CH. One dose actually I gave her at my office. Then I gave her a bottle to take once a day for 5 days. Then immediately followed by Natrum muriaticum 30 CH, 2 times a day for 3 days, once a day for 4 days, and then take 7 days break. So you all know that what's Natrum muriaticum is a chloride of sodium, but in a homeopathic form. So it has a characteristic, from mentality, from all the generalities. So these are very sensitive people, introvert people. They have hysteria, they're reserved, they have chronic grief. They're very romantic, very perfectionist, close and responsible people. They are dignified, they are very serious, overly proper, easily offended and wounded, very sad, but they're unable to cry. So when I checked NatMure and compare it with the picture of the patient, it was just more than similar. So Polychrist Natrum muriaticum covers mental, general, and from head, eyes, throat, gastrointestinal, urogenital, chest, extremities, and sleep. All materia medica, all Polychrist in materia medica, they cover wide range of symptoms and also organs, tissues, and systems. So I started giving her homeopathic organotherapy. If you remember, in a cancer case, I did not give her organotherapy because organotherapy stimulates the organ, stimulates the hypothalamus, pituitary gland, thyroid, and the reproductive system. But in this case, she didn't have any problems, so it didn't have any tumor. I started organotherapy with her, which is very essential for stimulation, activation, and support of the pathways. So this organotherapy is including pituitary, thyroid, adrenals, thymus gland, pancreas, and ovaries, and in a low dilution to D12. So I gave her gemotherapy 1D as well, rubicidus, which is an amazing female remedy it's safe for pre-pregnancy, during pregnancy, after pregnancy. I chose only one that is the safest for her in case she gets pregnant, we're not worried about. So there are a lot of different remedies also that you can choose for, this kind of case. But in case that she gets pregnant, for example, one of them that I chose, but said during pregnancy should not be used. I said, okay, I better not to give it to her. So I'm very conservative in some cases. I gave her tissue salts, magnesium, magphos, and also caliphos. I gave her oligotherapy, zinc and copper zinc, and also the nutritional supplements during the treatment. So my patient asked me, what's the relation between my grief and infertility? Why you keep asking me about my life and how I dealt with my loss of loved ones? I said again, I'm not treating your infertility, I'm treating you. So acute or fresh grief cause pathological changes in the tissues rather than functional disorders. So I gave her Ignatia because Ignatia picture with her picture, which she was very reserved, but she was very romantic, very dignified, very responsible. It was a picture of Ignatia. And even though she had chronic grief, but the way that she was talking, it was still fresh for her. So Ignatia Amora was a great remedy for acute grief, but I gave it to her because to me, it was unprocessed grief. When the process is not grief, it's still acute.
Dr. Zarrin, sorry to interrupt, but if you're moving the slides aren't moving.
Okay, sorry.
We're still looking at chronic grief. That's still what you have?
Okay, yes. Now no, that was the acute grief. So I gave her acute grief remedy Ignatia Amara, and followed by chronic grief Natrum Muriaticum.
Okay.
So she asked these questions, why you're giving me grief remedies instead of infertility remedies. I said, because the grief caused you be infertile. So I have to remove that first, the charge of the grief. So then I followed with Natrum Muriaticum 30 CH. I didn't give her too high, like 200 CH in the beginning. And so she was very, you know, the Natrum Muriaticum picture is introversion and very serious, reserved, and extremely easily hurt feelings, cannot tolerate humiliation or criticism, prolonged grief and depression, and grieving without crying. So many physical conditions, either functional or pathological, can be caused by prolonged grief. So she was presenting the picture of Natrum Muriaticum, very close, very responsible, very dignified, and very, very affected by grief. So Natrum Muriaticum was a similium remedy when generally when we find 80% of the characteristic of the medicine match with the person, we call it similar. We don't have to find the same. We call it similar. It was more than 85%. So the Lachesis case was way more than 85%, but this one, it was just about. So it was a very challenging case because infertility is a challenging case because two people are involved, right? When you want to make, you know, somebody fertile, so the other person has to be in a right situation as well. So I asked that I have to treat your husband at least for 1 or 2 protocols, but it was very challenging to bring her husband. So I had to kind of, you know, get involved with this, that, you know, if you really want to have babies, so that's the only solution. So anyway, I treated the husband. The constitutional minimum medicine for the husband was lycopodium. I gave him lycopodium 200 CH for 7 days, 2 times a day for 3 days, and once a day for 4 days. And then I asked him to stop for 7 days. Again, the same protocol that I give to everyone, from gemotherapy, tissue cells, oligotherapy, multi-oligo, and nutritional supplements for female and male. I gave it to him. He was only on 1 protocol, 1 lycopodium, and 1 protocol for 6 weeks. And I asked him, you don't have to come back. So it was a first follow-up, February 2nd. All generalities includes sleep, energy, temperature, mental state, fear, anxiety, and whatever she explaining was improved, as she said. And but no change in thirst and urination was still high. And she had the first menstruation in January, and she had light spotting started before menstruation for the first time. She never had a spotting before, and she was panicking. She said she never experienced a spotting before, but this time she was worried about the changes. So I changed the protocol. I changed the protocol a little bit. Natrum Muriaticum 30 CH, I suggested to reduce instead of every day to every other day. And also I changed in tissue salts and also organotherapy. I asked actually organotherapy to stop for 2 weeks because too much of a stimulation of organs, hypothalamus, pituitary, ovaries, might just a little bit too much for the person. I asked her to stop organotherapy. Too much of stimulation is not needed. And but she continued the rest with oligotherapy, chemotherapy, and nutritional supplements. So February 16, that was the second follow-up. The second menstruation happened. She came to me and she said she had very sharp pain in left ovary, and she never had pain before. And she said this time she was 2 days late, her cycle, and she had lots of clotting, feeling some hot flashes before menstruation, which she said she never had. And also the memory of grief of losing her brother and father are back. And she started crying, but she said, I cry, but I feel okay. And she said she's still very sensitive, she's still very thirsty, but in somehow, she said, the relationship at work and at home is better. And she feels that she's more tolerant. Even her grief was bad. This time, she started talking about her brother and father, but she started crying. But again, she said, I'm okay. I'm feeling at ease, you know. It was a releasing of suppressed grief. So physical symptoms, pain, cramping, clotting, hot flashes was getting worse on the second menstruation after the treatment. Some of them she never had before, but mental and emotional symptoms were getting better. So again, I went high on natrum muriaticum. I went to 200 CH, but this time once a week, 1 dose for 1 month. And I increased potency, but less repetition, less frequency. Okay, I put her back on organotherapy and also on homotoxicology medicine for pain, for dysmenorrhea, for uterine cramping during menstruation. So these are all the remedies that they are in this complex for pain and colics during menstruation. And also I put her on a menstrual colic and cramps tissue cells. There are special tissue cells that they are absolutely wonderful for colic and cramps during menstruation. I put her on physical more this time, but natrum muriaticum, I went high to 200 CH. The third follow-up, March 7, she went to a hypo state. She said she has low energy, she's tired, she has low appetite and feeling of depression. But sleep longer, and she doesn't want to have too much activities. So the body started from, from hyperactivity go to hypoactivity for alternation. It's a form of calibration, balancing. This is what the inner wisdom doing to keep you survive. So, and again, she said she's sensitive. She still have high, but the appetite is higher. And this time she says she's craving more for sweets and salts. And sleep and digestion are good. Again, thirst and urination is still high. And so these are the clear physical symptoms of natrum muriaticum. So when I compare the things that she was telling me, this match with the natrum muriaticum picture. So she had third menstruation in March. She said it was less painful, less spasm, less cramps. And I asked her to stop natrum muriaticum and all organotherapy. Again, that's how I do it with protocols. They go on a break, we stop. Again, they go on a break, we stop. That's how we do it. We just let the body, do it on its own. And when it's exhausted, we're going to put them back again. So this time I add more chemotherapy for female vitality, and in addition to pulpositis, and I continue the rest of the protocols. And it was March 22. I asked her to go for a longer break, stop all protocols, and go on a 2 weeks break to let the body heal on its own until next follow-up in April. The fifth follow-up, April 12th, fourth menstruation in April. She said 2 days delayed, but no cramp, no clotting, no pain, no hyper states, and no feeling anxiety or depression. I'm feeling good. Everything she explained, she was good. This time she was very talkative. And at the follow-up, she never talked before. It was a giant shift in mental state and personality. That's a natural muriaticum characteristic that is open you up. Normally in homeopathic practice, that's how we learn. If somebody doesn't talk, give her a dose of natural muriaticum. So she said she had vertigo 3 days before the fourth menstruation, but prior to this, she had vertigo before she came to me, but for a while she didn't. This time she had the 3 days before menstruation, and one day she said she had vertigo almost all day. A mental state feeling much better than ever, even though having some physical symptoms, because some old physical symptoms that were suppressed coming out. To me, none of them was the new symptom. They were all suppressed. So physical symptoms always alter the mind, and mind always alters physical symptoms. These two are kind of in alternation. So I asked her, because the old symptoms are releasing, coming back, and old symptoms are not pleasant at all. So because again, I don't want a person goes through aggravation for a long time. I asked her to stop natural muriaticum, which is the main constitutional remedy, because natural muriaticum has a high aggravation if you taking it a long time. So reduce the dosage of all medicine. So that's the time that to reduce everything instead of like every day. You can do it like 3 times a week. Because again, when I see that the old symptoms coming back, I try to, go, less repetition of the medicine. Slowing down the protocol in order not to experience heavy and steady aggravations. So my assessment was about deciding the next move. So a lot of physical symptoms came out, but the mental symptoms got better. So these are the summary of all the physical symptoms. Delayed menstruation 2 days in the month of March and April, short-lived vertigo during last cycle in April, worrying that she will never get pregnant, become very talkative and open about her emotions, which was unusual comparison to being quiet, reserved, and private all her life. Kept saying, I'm strong and okay, and talking about everything openly. Talking about the loss of her brother and father openly, with expressing her sorrow and emotions. Talking about not being cared in marriage, not being paid attention. She was very artistic, interior designer, fashion follower, like well-groomed women. So normally, people in abusive relationships normally get out after taking natural muriaticum. Natural muriaticum is a key remedy if in abusive situation. So my assessment was that natural muriaticum was the right selected remedy for her. I did not change the remedy. Sixth follow-up. May 10th, she called me. She called in. She said, missed cycle for 5 days. I scheduled her appointment in my office, and I did pregnancy tests in my office 2 times, because the first time she was shocked. She said, no, it cannot be true. I said, okay, let's do it one more time in a couple of hours. We did it again. Pregnancy test was positive. Pregnancy happened in 4.5 months from starting my treatment, after only 3 menstrual cycles. She got gestation diabetes in 8th month of pregnancy, and again treated by me through her pregnancy for diabetes. She refused to take any medications. And even though she was, staying at hospital sometimes, but she did not take any medication. Visiting my office weekly to follow up and review her diabetes daily test for morning, noon, and evening. She was doing it like weekly, and she brings it to me 1 week, test result. Diabetes was completely removed by my protocol without taking insulin or any form of medications. And for the labor pain remedy, I gave her tissue salt combinations. I gave her to their family to give it to her during the labor pain, and they took her to the hospital with them, and they gave it as soon as she went to labor, and she gave full-term pregnancy and gave birth to a beautiful, healthy boy in full pregnancy term. So that was the second case, infertility, and Natmure cured her.
We want a few questions, and I think we're coming up on 2 hours here. I think we'll sort of end it after that, if that's okay with you.
Absolutely, it's
Okay.
it's your
a question about the Natrum phosphoricum.
Natrum phosphoricum.
Yeah.
Okay, what's the question?
I'm not sure. Also good for fertility.
We don't have.
It's a comment in the chat. I'm just looking at.
We don't have homeopathic medicine for infertility. We don't have homeopathic medicine for pathology. We have homeopathic medicine is for the picture of the person. So,
okay.
But when it comes to like natrum phosphoricum, such as like, it's a beautiful remedy in tissue salts for heartburn, for acidity, for digestive problems. And I recommend natrum phosphoricum to so many patients, but in a form of tissue salts.
Okay. The next is, it seems quite a contrast between her lycopodium constitution husband and her own natrium to Ignatia worry about death and family concerns. So couldn't that have also been a problem?
Okay.
Well, that's the question. Could that be a problem, that there's a contrast in their constitutions?
The husband was lycopodium, and the wife was natrum muriaticum.
Yeah. Again, I'm reading one of the comments here. So.
I just want to understand the question.
Yeah. Well, that's the question, right?
So there is contradictions between lycopodium and natrum muriaticum.
Could that be one of the problems with the fertility?
Not in this case. No.
Okay.
No. The case was a trapped grief emotion for a long time, and Ignatia and natrum muriaticum removed it, and she got pregnant in 4.5 months.
Okay.
So with the same lycopodium guy. So
would she possibly later need the complementary to natrium, which is sepia remedy? Do you do this if the mental state changes to shift to the complementary remedy?
Sepia is complementary to natrum muriaticum. Actually, they cover the same picture. Sepia is an animal kingdom. Natrum muriaticum is a mineral kingdom, and they're not the same, but they're they follow each other, and also they're complementary too. So, but she was not sepia, so I don't. With the major cases, I don't go with chemo prescribing. I go with the picture of the characteristic. So
okay. And lycopodium could be a macho womanizer. LOL. So I don't know.
We cannot stereotype people. We don't label people because of this. But in the lycopodium, Material Medica, that's how it explains it, but I don't go with that.
Okay. Okay, that's all the questions in the chat. Do you have just a little summary for us here? And then we'll turn the video off.
Okay.
Any parting words? Any parting words for our guests here?
Again, from it's a completely different perspective. I'm coming from different domain of homeopathy. I treat the person. I do not treat the disease, right? That's why sometimes I cannot, understand the question. Sometimes I apologize because
you did great.
No.
You did great.
You did great that you repeated it for me. So,
okay.
And,
one more question real quick, Doc. It's not going to be. How deep do you psychologically go into your patient? Because it sounds like you want to get into who and what the patient is before you start to prescribe and deal with homeopathic medicine. So it's like, have you developed a process to psychologically dive deep into what's going on with the patient?
That's how homeopaths are trained to take the case. When we say homeopathic case taking, that's the process that you gotta get to know the person, because you're treating that person that is disharmonious. So, and that this person is not only physical body, it has mental body, it has emotional body, it has subtle body. You've got to understand all the dimensions of this life. It's a life in front of you, right? So this piece of life is disharmonious. You have to understand it, why. So that's why, then according to the constitutional or homeopathic case taking, we have questionnaires. The questionnaire start from chief complaint. What is your chief complaint? Say, I am infertile. I cannot have babies, right? That's a chief complaint, right? Then a little bit of more questions about that, regarding to that chief complaints, a little bit of, peculiar symptoms or modalities about that. Then we get into the rest of the person. The rest of the person is the different bodies. So, what I learned through my schooling and through my practice, that the majority of successful cases that I have done is based on the mental state, has been on the mental state. For example, if I have 10 big questions, 6 or 7 of them is about their mental states. So it's leading me to understand the person better, because the pain and the physical symptoms, it could be similar to so many. But when it comes to mental state, it's unique. The uniqueness of the person leads me to understand it and to match it with the picture of the medicine, not the physical symptoms, not the term of pathology. Those are not significant for me or for any homeopath, only the person. So,
great. Thank you.
Yeah. And especially Dr. Hahnemann has a big statement in his medical art, organ of medical art. He says, if you want to really understand the person, ask questions about the mental state of the person, because the physical symptoms, when it's suppressed, is going to move to the mind and it's altering the mind. The more alteration, the deeper the disharmony is. So when why did my patient, the infertile patient, started getting a lot of physical symptoms after natrum muriaticum, started getting pain, started getting colic, started getting vertigo, right? She didn't have that. before. She didn't have hot flash. She didn't have all those physical symptoms because the alteration of the mind now it's easing off. So it's the whatever is been thrown to the mind, it's coming back to the physical.
Right.
So when it comes to the physical, then it's going to go away. But if it's stuck in the mind, such as grief, chronic grief can cause a lot of malignancy problem. So that's why I have to understand that part first to bring it to the physical and to remove it.
Amen. Exactly. No,
I just wanted to make a comment for Dr. Zarrin here. So being in the homeopathic board here in Nevada and being a part of it as in terms of years, I have seen classical homeopathy. I have seen so many mix of how homeopathy is getting practiced, but you definitely are practicing integrative for sure. And the best part about your intervention is you're mixing this. But I see that you do minerals. I see you doing diet as well. Because there's a lot of practitioners who only focus on the art itself of homeopathy. So this is something really is merging into combining basically different sciences, not only homeopathy, but sticking with your classical homeopathic approaches, because there are now, as what we call even multi-remedy approaches in terms of trying to address the different toxicities of the world now that we have. But in your aspect, this is really a good approach. And I like how you treat patients in a way of a chronic approach. Though as part of, I think my shameless plug also, I'll be speaking to your conference in relation to acute uses of homeopathic remedies. So this is probably a good aspect for other medical clinicians to get introduced to homeopathy because it's a little bit more of a simple approach, but this is definitely a good in-depth discussion of chronic and very complex homeopathy at its best.
Yes, thank you so much, Dr. Noria. I'm delighted to have you at the conference. Thank you so much for joining next week. And thank you for your comments. Yes, I'm always calling myself, I'm an integrative practitioner with the foundation of homeopathy. And I don't deviate from homeopathic principles, but homeopathy cannot do a miracle. It's a medicine, but it cannot do miracle if the nutrition is bad, if you're in a wrong environment, when your water is polluted, when your air is polluted. So these are something, and when your body is toxicated. So, even the classical homeopathy gets exhausted. The reason that I got into that, because a lot of time I faced challenges. It worked, it stopped. Again, worked, it stopped. Then I realized that it needs more because Dr. Noria, you know that, I don't know if you studied miasms, right?
Yes.
Different miasms. So we have different, so many layers that compared to 200 years ago. The miasm is changed. The depth of miasm are the same, but I mean the human beings are having more layers now than 200 years ago that Dr. Hyman developed this system, right?
It really helped me with me understanding miasms because these are named after sexual transmitted diseases. But when you read it through homeopathy, you discover that it's not really that. There's more to that than being a syphilis, being a gonorrhea. So, but this definitely is worth looking into if definitely practitioners are looking into an in-depth education about homeopathy.
Mm-hmm. Exactly. So at this point, then I developed, as I said, homeopathy is the mixture of science and art, right? And I went to Germany 2009. It was a exchange of homeopathic knowledge. We were like about 400 homeopaths around the world. And we were 2 from Canada, but I think 3 from the United States, and the rest were all over the world. And they were all classical homeopaths. And it was amazing to listen to everybody and the cured cases, many from Argentina, from Egypt, from Latvia. There were, but not 2 homeopaths that were having the same approach. The art of homeopathy is something that you have to the homeopath is going to make it. Like the foundation is the same, the principles and everything. But when it comes to art of homeopathy, not necessarily all homeopaths do work the same way.
Right.
So that's why, my homeopathic art is different than so many other homeopaths. And the other homeopaths, actually, they're calling me, what's your secret that you have so many cured cases? I said, there is no secret. I just integrate with the other compatible modalities, which is the family of the same domain of homeopathy. So I'm not an orthodox homeopath, but I'm a classical homeopath.
I think, Dr. Zarrin, that's also applicable to our allopathic methods here, that people kind of judge other practitioners about what they do. And a good example would be, and Dr. Clearfield would be a good person to vouch for this, are pellet therapies for hormones. There's so many comments about this in relation to how objective this would be for other practitioners. They would put shame on you if they find out you're using this. But the thing is, if you see the pattern would be, it's always going to be the benefit of the patient. So we have different ways to get to a benefit. But the thing here is, it's just the route that people judge on. The thing here is, even for homeopaths, as you said, we just take different paths. But the important thing is the patient that definitely would heal in just a different fashion. But healing is always the best goal for everyone, right?
Exactly. So, yes, I would never change my approach. It's something that I have conviction. I would never change it. So no matter if anybody criticizing me that why I'm using homotoxicology. First of all, for example, I was criticized about homotoxicology. Homotoxicology is homeopathy. But if somebody doesn't want to use it or doesn't want to be trained, because it's not an easy thing, so don't blame somebody who has been trained and likes, to help the other to, improve their health faster. So at this point, I created my own, and that's why I teach it. Now I teach it. I teach it to medical doctors. I have 24 medical doctors at this present moment. Some of them are graduating. Actually, some of them are coming to the conference to present their research. And these are, I made it the way that is very, convenient, and it's very approachable for medical doctors to bridge from allopathy to homeopathy without harming any domain, like not harming allopathic domain, not harming homeopathic domain. That's why homotoxicology is playing a huge role here for medical doctors. For bridging to homeopathy is the best tool. So, so we have classical homeopathy department, we have medical homeopathy department, we have integrative medicine department at the Bioquantum Academy. Dr. Clearfield is in medical homeopathy department. We both are going to.
Okay.
we both are going
Well, thank you so much, Dr. Zarrin. We're going to